Okay, what is the most appropriate next step in the staging and management of this patient? Endoscopic mucosal resection, endoscopic ultrasound, esophageal manometry, palliative chemo, and PPI. Okay, so this is like a gastrointestinal question.
Okay.
55-year-old woman with a history of GERD and Barrett's presents to the clinic with worsening dysphagia and unintentional weight loss over the past 3 months. Upper endoscopy is performed and reveals a mass in the distal esophagus. Biopsies are taken and confirm the diagnosis of esophageal adenocarcinoma. Okay, most appropriate step in staging and management. So we already have the diagnosis. Um, and I say you have to also do a staging. So PPI is not really used for staging.
Okay.
Um, Same for manometry. And then I don't think palliative chemotherapy would be involved in staging a
Okay.
disease. Um, and then endoscopic mucosal resection. I don't think, I mean, I guess so. I'm between ultrasound and mucosal resection.
Okay.
Hmm. I mean, I don't think an ultrasound would do any management because you can see the characteristics of it, but we already have a diagnosis. We've done a biopsy already. So I think I'll go with the mucosal resection.
Okay. Final answer.
Yeah.
Okay, a better answer would actually be endoscopic ultrasound. I'll tell you why. Okay, so let's talk about staging. Okay, so what do you need to do to stage a patient? Like, what is the classic staging for all cancers of the body? What do we use? What
The TNM staging.
Yeah, TNM staging, right? So talk to me about TNM.
I guess T is like the tumor size
Okay,
is, and then N is like lymph node involvement,
okay,
and then M is metastasis.
okay. So let's talk about cancer in general. Okay, so before you can manage anything, or in a sense, think about management, right? You got to stage them correctly, right? So let's say you picked A, which is endoscopic mucosal resection. Okay, what do you think is the issue with A versus B? So talk to me like, so you have a cancer that you've diagnosed with a biopsy, but do you know any of the TNM stage?
No, you don't. Yeah.
Yeah, right. So, for instance, let's say you do a resection. How do you know how deep? How do you know what kind of resection? Do you need to consider? Are there any lymph nodes that you have to take out too? Is it advanced? Right? Is it metastasized? Right? So I think A is more of a management question. I mean, a management answer. And then you might be asking, like, well, how is B management, right? That's probably what's going on in your head, right? So to stage something, right, and to manage something, right? Imaging is part of that management, right? When you say, hey, what is your next step in management? Getting imaging is also part of management. You get what I'm trying to say?
Okay.
Yeah. So here, a better answer is if you do an ultrasound, what is that going to give you? That's going to give you tumor size. That's going to give you, are there any lymph nodes that might be in the mediastinum that's lit up? And then obviously you don't have your M, right? So you probably need another imaging like a PET scan or something like that, or CT, CT neck, chest, abdomen to give you your metastasis, right? T, N, and M. And then from there, right, if you talk about cancers, it's a holistic plan, right? That you're talking with the surgeons, the medical oncology, radiation oncology. Then after you get your staging, then you can say, okay, what do we need to do? Do we need to do surgery? Do we need to do radiation? Do we need to do chemo? Do we need to do a combination? Do we need a plan for after? And so definitely jumping into surgery initially, right, is going to mess up that plan. You know what I'm trying to say?
Okay.
So questions about this?
No, I think that was a good